This is part 12 of our series on nerve entrapments. The topic of this video will be an entrapment of the radial nerve. In this video, I will cover the following: function of the nerve, common locations of nerve entrapments, why this nerve entrapment occurs, clinical signs of this nerve entrapment, and lastly, how to effectively treat this nerve entrapment using both manual and instrument-based treatment methods. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert, specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning and long-lasting pain relief. I'm also the creator of the PEAK method and the founder of the soft tissue treatment revolution, where we teach self-employed and overworked massage therapists a better treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid that dreaded burnout, and help a hell of a lot more people get out of pain. All right, nerve entrapments part 12. If you haven't watched any of the other videos in the series, I will link it up top here. If you're watching it on YouTube, anywhere else you're watching this video, it will be included in the description below. But this week I wanted to cover the radial nerve getting entrapped anywhere from the neck all the way down into the hand and the wrist. So let's get right into it. So what is the function of the radial nerve? It actually has a motor function and a sensory function. The motor function is to stimulate muscles so you can straighten and raise your elbows, wrist, hands, and fingers. The sensory function is it provides touch, pain, and temperature sensations to portions of the back of the upper arm, forearm, and to the back of the hand and the finger. It's why it's called a mixed nerve, because it does both motor and sensory. So where does it get stuck? One interesting fact about the radial nerve is it's the biggest nerve of the upper extremity. There's a lot of nerves that go on up there, and I've covered a lot of them throughout this series, but this is by far the biggest nerve and has the biggest contributions to it as far as where it goes. Where it gets started is up top in the scalenes and the nerve roots up there, and it actually is part of the C5 all the way to the T1. So it basically controls a lot of that upper extremity in there as well. And a lot of times where I tend to find some of those nerve entrapments in the scalenes that I've covered in past videos is specifically between the middle and the posterior scalene. That's just where a lot of friction happens, where that nerve gets caught, and a lot of entrapments can actually occur anywhere from that C5 to that T1. Another area where I end up finding it is in the brachial cords at the subscap. Essentially on the front part of the armpit is where the brachial plexus sits. The radial nerve tends to be a little bit higher up in the armpit, like a little bit more lateral out there, a little higher up in the armpit. Another place where I can find a radial nerve entrapment is going to be in the triceps and brachialis muscle, where they kind of come together. There's some junction there where they get stuck together, and the radial nerve can get caught as it pierces its way through that muscle junction as well. And then another place where it gets caught is to the supinator in the forearm, which is actually deep to all the extensors as well. So why does this nerve get stuck? Cover this in all the trainings, but number one is just poor and sustained posture. You develop what's called scar tissue. So a lot of people think when they have a scar tissue, they're like, well, I didn't have any direct injury there. Well, a lot of overuse stuff can go on as well, where those muscles are constantly contracting. When they're constantly contracting, they do not get enough blood flow. They do not get enough oxygen, which in turn sends a signal to the brain, and the brain goes, hey, there must be a problem here. So it starts laying down immature collagen fibers. Eventually that scar tissue builds up, gets bigger and bigger, gets stuck to the nerve. Nerves are built with about 15% of extra slack to keep them healthy, gets stuck somewhere along that chain. Another one is just that repetitive use. Maybe people that use their hands a lot, maybe athletes, things like that, where those extensors are really getting overworked, or maybe the shoulder, or even in the neck as well. Definitely can be some issues with injury or trauma in there, possibly like a shoulder issue, injury to the elbow, also a neck injury as well, and a cervical spine injury. And then also just issues from past surgery. Sometimes maybe if someone had surgery on their breast or somewhere in their shoulder with their lymph nodes, they might have cut a little bit of the radial nerve. Definitely some cervical spine issues, and then also some surgeries down in the elbow as well. So there's a lot of reasons why this can get caught and stuck. The most is just going to be repetitive use, poor and sustained postures as well. So some common injuries associated with an entrapment. First one is going to be wrist drop, basically where the wrist just drops because those muscles' job is to help do this motion in there, and they can't. The wrist will start to drop in there. Everybody's favorite when they get lateral elbow pain, they call it tennis elbow. What it really is actually an entrapment of the radial nerve in there, which presents with pain in the lateral part of the elbow. And a lot of times, I'd say 90 to 95% of tennis elbow presentations are actually an entrapment of the radial nerve. Another one is just pain in the armpit after using crutches. So when someone's on crutches and they're there, it's pushing right down on that radial nerve into the brachial plexus, and that can give some pain down the distribution of the radial nerve as well. Another one is called Saturday night palsy. Basically, that means if someone's drunk and they're passed out on the bar, their arms are up over the edge there. Kind of same thing as with the armpits on the crutch. It can cause some issues in there as well, and some compression of the radial nerve. And then the last one is just pain, numbness, or weakness in the forearm, wrist, or fingers. Remember what I said, that radial nerve, when it has an entrapment, the radial nerve is mixed. It does motor and sensory. So the pain definitely can be some of the sensory, the numbness is some of the sensory, but then the weakness can show as well. So that's a lot of what nerve entrapments present with, is numbness, aching, burning, tension, and pain when there is an entrapment. So how to effectively treat it? You got to really check the whole course of where it's going. And one thing that I talk about, and I train a lot in my system called the PEAK method, is taking a thorough and detailed history and then a precise and focused functional evaluation. Because if you don't know where the problem is in the first place, you're never going to be able to fix it. So many people just want to jump right in. Like, say the client comes in and you go, oh, my lateral elbow hurts. And you go, oh, you got tennis elbow. I'm just going to start working right there. You don't really know what's going on. Was there trauma there? What do they do? What do they do for a job? Do they sit all day? Have they had shoulder and neck issues? All sorts of things. We kind of have to figure out all of that and figure out, kind of be like an electrician and trying to figure out where the kink is in the line. And we have to work our way down the chain to see where we go. So what I like to do is I like to start up top with the radial nerve. And what I start first is I go in there and treat the nerve roots at the scalenes, anywhere from C5 to T1, using a manual approach where I get proper depth and tension. I've shared that in some other videos where I treat the scalenes as well. And when I'm going in there and I'm feeling what is giving me the most tension and pressure back, when you get on a scalene that's stuck to a nerve root, it's very tender to the client. And when you go through the motion and you apply depth and tension, you take them through a full range of motion, it will pull a lot more. You'll feel a lot of pressure under your thumb as you're doing that. So I like to start up there. Next thing I like to treat is right at the brachial cords at the subscapularis. And the radial nerve, it sits a little bit higher up there in the armpit, like further up and out towards the shoulder there. So when I actually treat that, when I treat like the ulnar nerve and sometimes the median nerve, I just kind of bring their arm here and straight back. That gets a lot of that tension in there. But in order to really get on that radial nerve and open it up, what I actually do is drop it in and then I do internal rotation. When I do internal rotation, it really allows me to get optimal depth on that radial nerve because it's really buried up there higher in the brachial cords. Next area that I start to treat is at the triceps brachialis junction, especially on the lateral part there of the upper arm going into the elbow as well. I like to use an instrument first to go in there and clean up some of that superficial muscle adhesion where it's getting stuck, go in there and break that down. Then I'm able to actually get in there with my hands and get proper depth and tension and then have them go through a full range of motion. And then the last area where I do like to treat, and I find a lot of radial nerve entrapments, is into the supinator, which is on the lateral part here of the forearm. And that's right where that radial nerve sits, right on top. And a lot of times there's going to be a lot of issues in there as well. And that's an area where you want to clean up all the extensor component above that to get that cleaned up. Then you can go in deeper, get proper depth, proper tension into that nerve and start to break that down. So there's a lot going on with the radial nerve. There's a lot of areas where it can get caught, and big things in the history as well. Asking yourself like, hey, their elbow's hurting, but there was no direct trauma there. So I'm usually thinking it's going to be something higher up and I'm going to work my way up. But you want to check everything as you go. And your goal as a clinician is always to take things off of the plate. If you think it's that and you treat it and then it's not, then there's one less thing. You want to keep taking things off. You don't want to treat every single thing in one visit. You don't want to treat all the scalenes. You don't want to treat the brachial cords, the tricep at brachialis and supinator all in one visit because you don't know what's going to work. So what I like to do is treat one thing at a time and then see how those symptoms improve, how the functional tests improve as well. This is how you get to that path, what I talk about, working smarter, not harder, and solving problems. That's all I got for you guys on this video. If you liked the video, give it a like, a comment, or share. And you can also go in and download and access any of our free training modules where I go through a lot of the critical thinking, problem solving, get you on the idea of getting away from providing just a service to your clients, but more of a solution based and being a problem solver in your area. Honestly, the free courses I think are better than any other paid courses out there. All the information to do that is available wherever you're consuming this. I appreciate you guys watching, and I'll see you on the next one. Bye.